And welcome back to Moving Conversations. I'm Brian Ritchie. Joining me as always is Nora St. John. Good morning, Nora. How are you doing?
Very well, Brian. How about yourself?
Doing good, doing good. Just got back from Sacramento, actually, where you and I got a chance to hang out and uh, do a little discussing and talking and whatnot, as well as Ideal World. The fitness conference was this past weekend. It was a huge success. Everything went incredibly well and uh, got back safe and sound and back in the trenches this week.
So, Brian, what were you teaching at IDEA? What were the topics that you were teaching?
My first class was obesity,
Hmm.
programming for the obese or overweight client, which I find that a lot of fitness instructors don't really focus on that and try and train them the same as everybody else. But there are significant differences that need to be taken into account, especially when it comes to orthopedic issues as well as medications and things like that. So we talked a lot about that. And the other two went kind of hand in hand. I did a postural assessment course as well as one on upper cross syndrome, so dealing with cervical issues and uh, the and the like. So those sort of kind of went hand in hand, and they went really, really well. Everybody seemed to have a good time and learned a lot, and so yeah, pretty happy with it.
Fantastic. So, just for you guys who are listening, and maybe you're new to listening, um, this is something that we do on Moving Conversations all the time, as we talk about these different topics, and particularly topics related to clients with issues, injuries,
Mhm.
rehabilitation, post-rehabilitation, all that kind of stuff. And Brian's topics are all things that, a lot of which we've covered parts of in
Yeah.
previous episodes. So feel free to take a look back at that if any of those topics sparked your interest. I know Brian has a particular expertise in working with obese clients and larger clients. And that is a thing that, is certainly really common. Many, many, many people are larger
Mhm.
than they may want to be at the moment. And I think learning how to work with that effectively will really help your practice. And really, if you are somebody who's larger, it helps you to understand how to work better in your workouts or in your private training or whatever you're doing. So cool. Very cool.
Yeah, yeah. And you and I are gonna be teaching together coming up fairly soon. In September, we're gonna be heading to Southern California, huh?
We're going to be at Blue Moon Pilates, and we'll be teaching a whole day on the low back, looking at both, disc issues and all kinds of bony issues, and a little bit of theory, and then a lot of what to do, both from a more like I would say mat-based personal training perspective. So Brian will go through that, and then I'll be going through a lot of work on the apparatus and ways to really hone in on your teaching skills and your exercise choices and the specificity of movement that is most effective for those conditions. Then on the next day, we're going to talk about the shoulder, just give a general overview of the shoulder, and osteoporosis, 3 hours on osteoporosis. So what it is, what to be aware of, what the research says, and then how to work with it. So it should be really
Yeah.
fun.
Now, what most people don't realize is that you and I do come from slightly different backgrounds, but when we first met, we realized that we were sort of speaking the same language and that we sort of knew a lot of the exact same things and a lot of our teaching overlapped incredibly. I remember when you said, "Send me all of your classes," and I did, and you said, "Send me yours," and they were almost identical. It was kind of like, "Yeah, I teach that too. You teach that." Well, what's interesting is when we teach together is because we come to movement from slightly different visions. So there's a lot of overlap where movement applies, where Pilates meets fitness. That that con, you know, that area of overlap in the Venn diagram really is movement. And that's what we talk about here. And so when we get together to actually teach, we do come at it from all sides. So people do get to see, oh, you mean I can do that as well as this, and you can do this as well as that. So it really opens people's eyes up to hundreds of exercises they didn't even think about because there's a lot of times we get ingrained in what we already know that when you learn something from a different point of view or a different philosophy or a different modality, it's sort of, oh my gosh, there's so much more I could learn. So it's really a kind of cool experience to have us both there, sort of separate and, teaching similar things, based on the same theories.
Which really comes down to kind of what we wanted to talk about in this episode, which is how do we sit? Like, how do we sit as movement professionals
Hmm.
within I would say the rehab slash post rehab, pre rehab lineup? Like, where do we sit in that? Like, clearly, we do exercise, we can help people be fit and all that stuff, but we're really more specifically talking about how to work with somebody with issues who isn't a
Mhm.
normal healthy body just trying to get stronger, but how do you accommodate, how do you modify, and where do we sit in the kind of all the different practitioners who do that kind of work?
Yeah. What when I first got into this, I was teaching classes specifically on post rehabilitation and getting people interested in it. And one of the things that I talked about very specifically was called scope of practice. And that's what we're discussing here. And what I
Yep.
put up was the scope of practice written out for the state of California, whatever state I was teaching in, I would make sure I'd pull this up for a physical therapist. And it would
Mm.
have like 2 slides of very specific things, what you can do, what you're not supposed to do, yada, yada, yada. And then I would ask the class, I say, okay, now where is ours? As
Right.
fitness professionals, where is our list of you're allowed to do this, you're not allowed to do this? And nobody could produce anything. Very vague ideas of what we can do, but no one's really sit down and said, here's what you are allowed to do, or here's what you're not allowed to do. So I thought when you brought this up, I said it's a perfect opportunity for us to really dive into this and figure out what are we? What is our scope of practice? What can we talk about, with our clients? What are we allowed to do with them? What aren't we allowed?
And this is really the foundation of moving conversations. It's not
Mhm.
Pilates conversations, not personal training conversations, it's moving conversations.
Yep.
Because one of the things that I say often, like really often, if any of you've heard me say this before, please forgive me. Movement is what we do. Movement is the skill that we have. And
Mhm.
from my perspective, anything having to do with movement, whether it's observing, whether it's analyzing, whether it's assessing, and again, in that case, I mean specifically assessing movement patterns, mobility, strength, coordination. Those are all within our wheelhouse. Those are all things we can do.
Yep.
And then what we do with all that information is we design and hopefully an exercise program, movement based, that basically addresses those particular concerns. That's in a nutshell where I think we live within this world of rehab, post rehab, pre rehab.
Yeah. Yeah. I think for me, what was interesting is when I did dive into what physical therapists were allowed to do compared to us. Because when I first got into the game, uh, let's just say the lines were heavily blurred as to what
Yeah, and still
you were
are
and
to a
still are
large extent.
to a
Yeah, yeah,
large
yeah.
extent. And in fact, coming from both a body working background, a massage background, as well as personal training, and seeing things at some of these fitness conferences, it is interesting where the lines are blurred and why some other industries don't look too kindly on what we're doing because they do feel as though we're overstepping our bounds.
Right,
And
right,
like you said,
encroaching on their territory.
yeah, because if we're working with a client, if for instance, I'm just going to give a for example, one of the things that we're not supposed to do necessarily is hands-on body work. Now, you and I
Right.
have a background in it. That's different. But in general, not supposed to do hands-on body work with a client. That's responsible for massage therapist, physical therapist.
Right.
But where the lines get blurred is when you bring out things like these massage guns and
Mm,
massage tools and
right.
things like that. Because let's face it, I can go into the local drugstore and get a massage tool now,
Right.
that effectively becomes a tool that I used to use as a massage therapist, a Depot
Uh-huh.
device, one of these thumper
Right.
type of things.
Right, right, right.
And yeah, and in thinking about it, I was thinking, well, how that's what they're being used for. They may not be marketed for that. I keep hearing them marketed as a warm-up device, and I'm thinking that's an
Right.
interesting concept,
Right,
but that's not
right.
what I see them being used for when I go to the gyms near
No,
my house. They're really
absolutely
being
not.
used at the end of a session saying, "Oh, here, let me get this." And you and I both know from all of our experience, if you use one of those things incorrectly, you can actually do more harm than good. And these people aren't being trained at that. So that's one of those areas that the line can be blurred.
Absolutely. Absolutely. So, Brian, I just want to remind people, like, if you
Yeah.
really like what we're doing or whatever, please do a little like and subscribe. Take a moment, push those buttons, leave comments, leave suggestions, any of those kind of things. Do you want to give the
Yep.
details, Brian, on all that?
I will. And I wanted to give a little fact. Less than 20% of our regular listeners are actually subscribers. Now, when people do subscribe, those numbers go up for us, which get us more airplay, especially on things like YouTube, as well as on Spotify and on Apple Music. So, the more subscribers we have, if you listen to us, let's say twice a month, 3 times a month, and you're just downloading it, but not as a subscriber, we appreciate it. We love that you're listening. But as a subscriber, it helps us out a lot. So do us a favor, hit that subscribe button because it can make a world of difference and get us in front of a few more people. We really appreciate that. And going onto the platform of your choice and telling them, giving us a 5-star review also boosts our numbers. So we really appreciate that no matter how you listen to us. So do us that favor, hit us that like and subscribe button. Now on Instagram, we're at Moving Convos and we are posting up our new Anatomy Minis. So you and I recorded a bunch of stuff when we were in Seoul together. So a lot of those are coming out. So you're going to see us doing some different exercises that we haven't shown before. And sometimes we talk about exercises, and this is a great way to see it. So it's at Moving Combos. You can always DM us through that as well. And movingcombos@gmail.com is the best way to get in touch with us. So we can, answer any questions you have. Or if you have a topic suggestion, I love that because sometimes it's something that we're like, oh, of course, we haven't talked about that yet. Awesome. Let's discuss it. So if there's something on your mind or a question that you have that you're like, I wish I could meet you in person because I'd love to ask you this question. Hey, trust me, we answer all of our emails. So hit us up. We'll definitely either cover it during the show or we'll answer it right back in an email response. So those are all of our things. So let's dive in a little deeper into scope of practice.
So, a couple thoughts. So, we brought up where I think we live in terms of our skills and our skill set and where our skill set should be. Brian's brought up some places where that skill set gets fuzzy. Absolutely
Mm-hmm.
agree with that skill set getting fuzzy in different places. Hands-on is a primary place it gets fuzzy. And even that happens in terms of cueing,
Yeah.
hands-on cueing, because we're not always doing body work with our hands. Oftentimes just like, relax your shoulders, or, imagine your head is pushing up into my hands, or can you feel that your hamstrings aren't firing, right? We're
Mm-hmm.
using our hands, or can, if that's within the scope of practice for your state, because some states do have very specific
That's
things
true.
about hands-on scope of practice for personal trainers. Some don't. So just know there's gray areas there. So thinking about, touch and thinking about how we use that is a real key part of just being aware of your scope of practice, where you're comfortable, where you're not. Having been a client for many years from a lot of different people in a lot of different fields, I know that a client or a teacher with good hands-on skills can make a huge difference in how I experience that exercise. And an instructor with poor hands-on skills can also make a huge difference in how I experience that exercise, not in a positive way. So
Mm-hmm.
my other thing, if you are a hands-on person, and if that is something that you know how to do, I really suggest getting trained in it. Brian and I, again, both have a strong massage background and both been trained in it. Me both in Western and Oriental body work, both types. And take the time and go do some of that. Learning how to use your hands and then being legitimately able to do that because you have, a certification in body work, really, really helpful. There's so many things that I learned, and I'm sure you too, just through your
Yeah.
hands. You put your hands on somebody and you feel muscle tone, you feel tension patterns, like so much information comes through. So anyway, there's a suggestion for dealing with a hands-on piece. Get good at it. If you're going to use your
Mm-hmm.
hands, get good at it. Do not
And
assume you are good at it yet.
yeah, and something that you and I have talked about before is also intention with our hands.
Yes.
Because there are some people who, when I first got into this, there was someone who was training other trainers. I'm not going to use his name, but he was a little bit more, how should I put this, handsy with clients. Like, and nothing was ever suggestive, but he'd put his arm around your shoulder. He was a little bit more hands on than I would feel comfortable with just as just as me in general. I'm not that way. That's not my personality in general. But he definitely was a little bit more of that touchy-feely, and it worked for him. Today, with consent being something that is very, important when you have clients, it's really important that you, first of all, have good intention with where you're putting your focus and your touch. What I've often done is I'll usually use a single finger and I will put it right to the muscle that I need. Let's say I'm trying to get their lower trapezius to fire in an exercise. I will, that's my intention, just to touch that one muscle. And often I'll just tap it and say right here, or guide it along the way of shortening those fibers. Just guide it for 1 or 2 times just to remind the muscle. So intention can make all the difference, because if someone is just putting their hands on someone, that can be very uncomfortable for the other person. And asking them, especially if you feel them flinch away, you can see, oh my gosh, I had a client who did that. And later, as I trained her, I found out that she had an abusive past. So there was a lot of fear there. So she was someone I just didn't touch at all, not at all. You have to get to know the client, but getting that consent and then touching with intention, I think, are very, very vital.
And I would say, just to fuzzy the water a little bit more, that consent is interesting, because, do you mind if I touch you? And they say fine. And I have to listen beyond the fine. Like, for some people, it's like, it's obvious that
True.
that's totally fine. Like, it really is totally fine. Other clients, like, you just have that, they have that hesitation or that moment, like they're
Yeah.
not sure what's going to happen. If you hear any hesitation, just step away.
Respect
Like
it.
Brian, yeah, like for me too, Brian. There's one client where I asked, but it was not really clear. They said yes, but I wasn't really clear, and I didn't do. I really just literally put my hands gently on their shoulder, and I felt that kind of bracing. I went,
Yep.
okay, hands off.
Yep.
I just hands off. And so that's just something to be aware of in terms of our scope of practice. And if you're not comfortable with hands-on stuff, don't touch the client, period.
Yeah.
You can do everything you need to do with verbal stuff and demonstrations and other kinds of things. So just, be clear that is a gray area, though, that we just want to really bring that up.
Yeah.
When we go on, what I wanted to think about was, and I think about this both from a prehab through, like, let's say, rehab through post
Hmm.
rehab. Where do we live as movement practitioners within that whole arc? Right. And
Hmm.
I think you and I've talked about this a lot, but just to kind of clarify that, I know both of us have talked a lot about prehab. Let's say you've got a
Hmm.
client who is going to go in for knee surgery, or go in for shoulder surgery, or go in for hip surgery, or whatever. A lot of times, really a lot of times, and Brian's mentioned many case studies of this that he's had, and I've had a few as well. We go in and just do basic strengthening and mobility work on that particular area, both to either get them stronger before surgery, because they will recover
Hmm.
quicker, and that always is true. Um, or sometimes they get strong enough that they don't need the surgery. So, we
Yeah.
both had situations where clients have declined the surgery after strengthening and getting the area functioning a little bit better.
Yep. I've got a client that literally just told me, "Oh, I don't need to have the ACL done." She had a double ACL, one was repaired. We strengthened both. She had the other one scheduled, and she said, I don't feel like I need it." She talked to her doctor, and the doctor said, "No, you're strong and stable now. So for right now, let's just keep it as is. Why cut it open if we don't have to?" So you can get to that point through strengthening for some people,
Right. And not everybody, but it's
not
honestly, it is
everybody.
always worth a shot. I mean, in my opinion, and typically, even if a client is going to have surgery like that, if it's not an acute kind of traumatic
Hmm.
moment, and they've scheduled for 2 or 3 months out, which is often the case, like, do the best you can during those 2 to 3 months. And even if they still want the surgery and they're still having issues there,
Yep.
just the fact that they're that much stronger will really make them recover that much quicker when they're done. I've had
Yeah.
so many clients who got really pretty strong before surgery, even though they really still needed surgery. They weren't stable enough, and they come out and they recover pretty quickly.
Yep.
I've had other clients who just, went into the surgery cold. And I saw them after that, and boy, it's a much longer process to get them back if they didn't really do some work beforehand. So that's a really useful place for us, is in the prehab phase.
Yeah, and if you think about just in general, a client that comes from a sedentary background who has done nothing, you're starting at ground zero. So if they have a surgery, they're really starting from not ground zero, but like ground
Yeah.
minus 10.
Ground below. Yeah.
Yeah, they're in the
Yeah.
basement. So just to get them up to snuff can be a challenge. And that usually is what happens after the surgery and physical therapy. But they come to us still in a deconditioned state, oftentimes, especially with the rest of their body. If you can get them prehabbed and get them strong throughout their entire body, it not only works the muscle that you're trying to strengthen, but it also helps with mitochondria, which helps with, the body's ability to recover and heal. It helps with, better
Blood
oxygen
flow.
utilization, blood
Yeah,
flow, circulatory
exactly.
system. There's so much
Yeah.
that benefit from exercise, and we're not limited to just working that one body part either. We're working their whole body,
Yeah.
hopefully. So
Yeah,
if we are,
exactly.
they will recover faster. I have had 100% success. I have yet to have someone go in from prehab to surgery, come out and not have a great recovery and be faster than expected.
Yeah, absolutely. And the other thing too there about that is you help clients gain confidence in their body. And this gets
Yeah.
a little more woo-woo. This isn't just like feeling stronger and whatever. But you also have that client understand they can do something for themselves.
Yeah.
There's something very empowering about doing an exercise program before surgery because they come out of it and they already kind of know what they have to do to get better. Right. It's like
Yeah.
it's not going to be that different pre-surgery and post-surgery. You may start at a lower level or whatever, but you're going to do the same thing. And just having a client be familiar with that, feel like I've made progress, I know what I'm doing, that confidence, going into any kind of surgery is incredibly important. Again, regardless of how much progress you make in terms of strength and mobility,
Mhm.
just having them understand, like, I can do something, I can move, I'm competent, I'm confident, that really helps a lot too.
Well, if you think about it, just the unknown. I don't
Yeah.
know if how many
Yeah.
surgeries you've had. I've had more than my share. I'll be the
Yes.
first to admit that because I've had issues, physically, over the years. But with those, when you go in knowing what you're going to have to do afterwards, and I'm gonna be honest, a lot of times people may not hear everything that the doctor says, and the doctor may not be as forthcoming as to how rigorous the post-surgery phase is going to be and the recovery phase and all of the physical therapy, that if you already know, oh wow, this is kind of hard, this is tough, but they do it for a few weeks ahead of time, like, yeah, I got this, I can do this. Not having that be so unknown afterwards, it just feels as though, okay, I'm ready to do this, it's just what I've been doing. It does give them a sense of confidence. It gives them that
Yeah,
sense of, I got this. Whereas they don't
absolutely.
feel as overwhelmed, which I've had some people come to me afterwards and say, "I wish I had known. I would not have done it. I wouldn't have had the surgery." They needed it, but they're like, "This is so
Yeah.
hard." And if they
Yes.
need the other side, if they had one knee replacement and then need the other, and they say, "I'm not gonna have it. I'm not gonna have it." Say, "But you already know what to do, and we can
Exactly.
strengthen that side
Exactly.
now." And they say, "Oh, okay. Yeah, I guess so." So it makes a big difference.
It does. And so thinking about that, and I'm thinking about many of my clients over the years who've gone through that, because I think about this as like, if you get them beforehand and you can do some prehab, that's awesome. Then you have whatever surgery they're going to go through. And then you have this funny next phase. And I do want to be kind of explicit about this. Post-surgical depends on entirely what the surgery is. Sometimes the client is back with you or doing physical activity quite quickly. Right.
Yep.
If it's, let's say it's a knee scoping or something like that. A lot of times those are really pretty quick, and other things can be quick. Other things can be very, very slow, like ACL repairs, spinal fusions, all those kind of things. So in the ideal world, which we don't live in, unfortunately, those clients would be getting sufficient physical therapy to get them to the level where you can take them over. Like that would be the ideal world. And when I read through protocols for all these things, they really do talk about like a 2 or 3 month, like let's say after an ACL repair, a 2 or 3 month physical therapy routine, right? Where they really are working on mobility and strength and all that stuff. And then they move into more of the post rehab phase where they're just trying to strengthen and get everything back to functioning.
Yep.
Well, that would be lovely if that was how it always worked. That is not how it always works. And I really want to mention that because if you're a personal trainer working in this field or a Pilates teacher working in this field, I cannot tell you how many clients I've had who either just declined to get physical therapy, which is sometimes is the client's
Oh yeah.
situation for whatever reason, or got a very minimal number, 2 or 3 sessions after something like a massive shoulder surgery.
Yep.
And so they come to you, in my opinion, not having had adequate physical therapy. You're not a physical therapist. So all you have is your tools to help them. You can
Yeah.
still help them. You can. I mean, again, strength and mobility and movement patterns and getting the rest of the body stronger, like all the things we talk about, are all helpful. But it is something where that can happen. Like you can really end up, and I've had many clients who really should have had a little more higher level professional care before they came to me. Just to throw that out there.
Yeah. I can't tell you how many times I've had the exact same thing happen where the one that I've told many times is after a hip replacement. Client came back to me after I think it was a week and a half, 10 days. Now, normally 12 weeks, 8 to 12 weeks is standard. That's when we'll see them because they have to go through physical therapy. And he just walked in, and luckily I wasn't seeing a client at the moment. So we talked for a few minutes and he said, "I'm ready to start up." But I said, "No, you're not." I said, you can't drive yet. So if you can't drive, then no, you really can't. And they said, "Oh, but I should be able to. My doctor says I'm finished with physical therapy." He got 2 sessions right
Mhm.
afterwards, basically to teach him how to use a walker and a cane. That was it. Done. And I said, "Okay, that doesn't make sense to me." But
Mhm.
wasn't gonna be prescribed anymore. Some doctors
Right.
now feel you'll figure it out. Your body's gonna figure it out. Just walk on it. You'll figure it out. So occasionally that's gonna happen. And it was my choice. And I said, "Look, I don't know how comfortable I am with this. However, I do know that if I don't, no one else is gonna touch you." So I
Right.
saw him. And now, something that you need to know as the professional, 2 places that someone can get an infection. The number 1 is gonna be in a hospital, number 2 is gonna be in a gym. Okay, so we made sure we scrubbed every surface down that he was going to be
Mm.
near to make sure. And we use hospital disinfectant here just because of the kind of clientele we have anyway. So we scrubbed every surface just to be preventative. Normally, we don't want to see anybody until they have no open wounds. That's
Yeah.
just
That's a
general.
that's a really good guideline. This
That's
is
a good
not this is
guideline.
way outside my scope of practice.
Way outside, and he was one of the exceptions only because I'd been working with him for years, and it was actually during COVID, so nobody was in the facility but he and I, so I could scrub the whole place down. In general, no open wounds. But after that, it's sort of like, okay, if no one else is going to see you, at least I know I can strengthen you. At least I know I can get you more flexible and we can start at least something. It's better
Yeah.
than him sitting on his butt and doing nothing
Right.
and just hoping everything's going to heal,
Or just
which
starting to walk and compensating like mad and ending up with some, because when you just do
exactly.
sometimes when you just do what you need to do to get through life, you create compensation patterns that can then cause their own trouble down the line. And you may never get back to kind of a smoother, better movement pattern without some intervention in those circumstances.
Exactly, exactly. And we see that as professionals. How many times have you and I worked with someone who's come after hip surgery and they have a huge what we call Trendelenburg gait, where there's a hip slings out to the side, or they have this major funny
Yeah.
lean to them.
Yep.
And once they
Yep.
establish that, it's hard to erase.
Yeah. It takes a long time.
Yeah.
Yeah.
So you're going to have clients that are possibly going to do that. You're also going to have the client who will try physical therapy, hate the physical therapist, or
Yep.
the company or whatever. There's still a lot of physical orthopedists who are locked into their physical therapy, depending on the state you're in. Some are allowed to own the physical therapy. Some are allowed to
Right.
own it, but not run it. There's
Yes.
a lot of different
Yeah. Yeah.
rules
Yeah. Yep.
depending on your state. But if you're not getting the care that you need, or you're with a rank beginner, they may just feel more comfortable working with you because they've worked with you for years. So you may get that side of it as well. The fact that not that they just don't want to work with those physical therapists. So keep that in mind, that happens a lot as well.
One of the things that I can't emphasize enough at this point is that will happen. I mean, again, if you get into the post-rehab space as a movement professional, all of these things will happen. So we're kind of talking truth here at the moment.
Yeah.
We're not talking
Yeah.
the ideal. And with that in mind, one of the things that is invaluable is having resources, having people you can contact and go, hey, I've got somebody who is 2 weeks post hip replacement. This is what they had happen. What do I need to be aware of? Right? What do I need to be careful of? Especially if you're a beginner in this world or you haven't had a lot of experience like Brian and I have, like, know a physical therapist, know an orthopedic surgeon,
Yep.
have somebody you can talk to, have another Pilates teacher who knows more than you that you can talk to, or another personal trainer who has more experience. Like, use your mentors. I can't
Yes.
emphasize that enough. When I was working at the hospital and I was a baby Pilates teacher working with all kinds of crazy stuff that, I had to figure out. My best resource was I would go to a physical therapist. I'd say, hey, I just have a really quick question for you. This is what this guy's got going on. Anything I should know? And they'd say, well, do this, don't do this, do this. So, okay, some basic guidelines. And sometimes I would talk to a surgeon and I'd say, hey, this seems to be happening. Is there something I should know? And like, oh, okay. And they would tell me like maybe why that's happening after the surgery. So if you've got people you can talk to, do that. Yeah.
Yep.
So just
Yeah.
a reminder, do not be afraid to say, I don't know, but I think I can find out, and then go use your resources to find out. Really critical.
We we do have a saying, sort of, if in doubt, refer out. But
Absolutely.
at the
Yes.
same time, there may not be that opportunity. So having that mentor, I have a number of physical therapists who are friends of mine. So if there is something that I'm
Yeah.
unsure about, I can make a phone call. How many times have I reached out to you thinking, okay, I haven't come across this before. Have you? And we can mind meld together and figure out, oh, okay, this seems like it would be the correct course of action. And usually I've been at this long enough, I kind of know roughly where I want to go, but getting that second opinion, getting someone else to verify what I'm thinking is always beneficial. So if you
Yeah.
can make friends with a PT, especially a good one in your area, I highly, highly recommend it. And I'm going to take one step further and say, look for a PT that does body work and who only sees one client per
Yeah.
hour. They're
Yeah.
usually sole practitioners. They've gone
Yep.
away from the big model. They are no
They're
longer
often
in a
cash pay. They may or may not
cash
be insurance
pay.
pay. Yeah.
Right. They're usually that way because they've already established up a large amount of clientele. A lot of
Yep.
doctors trust them.
Yep.
And those are the ones that are going to understand the body to a little deeper level. Maybe they've been at it 20, 25 years, so they're going to have a lot of experience. If you're getting someone who's still working in a hospital environment, they see a lot of people, but they're also in the act of churning them out because they have a long line of people that need to get in and they're limited as to how many sessions they can see. So they get them to a certain level of function and then they have to exit them out of the program to let the next person in. That's generally how it goes. So if you can find a sole practitioner, a lot of them will have a lot of clients who stay with them for 6, 8 months as long as they need. And those are the ones you really want to cultivate. Those are the ones you want to make friends with because not only will they send more people to you because they're going to say, hey, he or she is willing to work with,
Yeah.
people who have just come out of surgery and they'll be more likely to refer to you. But also it gives you a great place that you can call for to have a reference call and say, I've got this and this. Here's what I'm thinking. What do you think?
Absolutely. So again, when in doubt, refer out and develop a referral network. I mean, Brian and I are happy to chat with you too. If you need like help,
Always,
we're both
always.
happy to do that too. And there are a lot of other people too in specialized fields that I'm happy to refer you to if we're not the people. So really, find that referral thing. The second piece about that is um, then where do we go from there? So sometimes you're going to get somebody, very often, many of my clients had been through this process. They had had an injury. They had, let's say, had some kind of intervention, surgery or something like that. They'd been to the PT. They didn't get where they wanted to go, or they didn't get far enough along the path of recovery, either because they only had 4 sessions paid for, or maybe that PT wasn't really equipped to give them the skills they needed to move forward, or they just needed more.
Yeah,
One of the
yeah.
fantastic things, and I really do mean this in a funny way, I thought at one point about going to medical school. I thought at one point about going to PT school for sure. And I really realized, I would rather work in this environment where I have clients for a
Mhm.
long period of time. They see me 1, 2, or 3 times a week, and I can actually really make a difference because
Yep.
movement takes time. Correcting movement patterns, doing all that's not in a 1, 2, or 3 time sessions. Like, you just can't do it in 3 or 4 sessions. I have great sympathy for PTs who have to do that. But we don't have to. A lot of times we're seeing clients every week or twice a week forever. And that really allows us to continually push and refine and improve their circumstance. And that's really
Yeah.
where we have tremendous value within the whole, post pre-rehab to post-rehab swath, is in really getting clients back to or up to whatever fully functional level they want to reach.
If if any of you have ever tried to build your muscle, either in bodybuilding or you're trying to lose weight or whatever it is, you know that it takes time. And I've told many people building muscle, changing your body, any type of change you want to make is like, creating a sculpture out of marble using a toothbrush. It's going to take time and it's going to take dedication. It's going to take effort. You're going to keep doing it for a while. It takes repetition and it takes consistency.
Yeah,
You're right. 12 sessions is nowhere near enough to take care of all of those functional deficits that they're going to have coming out of surgery, whether it's walking correctly, whether it's eliminating their limp, whether it's strengthening what needs to be strengthened. They're going to hit them with everything they can. And they have a lot more tools in their toolbox. And we'll get to those tools in a little bit. But they have a lot more of those tools besides exercise. By the time they come to us, it should be strictly the exercise component. But that's the same reason I do what I do. I was thinking about going into chiropractic school. I was thinking about going into physical therapy school. And then I interned with a chiropractor, with a physical therapy office, and realized you
mhm.
see people for how long?
Yeah,
5, 7 minutes. You see people for how long? 15 minutes. You're seeing 4 people at once, depending on the state you're in. Physical therapist, sometimes it's 2, sometimes 3, sometimes 4, whatever it is. It's like, wait a minute. This doesn't make sense to me because I'm already seeing one client for 1 whole hour. And yes, it's on a cash basis. I don't take medical insurance, but I see the client for the whole hour and I can do a whole lot more. And how many times have we seen that it's not just the part that's hurt, but all the other compensations? If it's their knee, well,
exactly.
if all they're focused on in physical therapy is the knee, maybe that's what they need. But sometimes it's the hip, sometimes it's the foot, sometimes it's the low back, sometimes it's
Right,
the whole kinetic
absolutely.
chain. We can
Yep,
deal with the whole kinetic chain, and that's what
yep.
we're good at.
And I wanna just spin this around a little bit, because the other thing too is, like, we've talked a lot about, like, surgery, right? Kind of an official, there was a thing, something happened, you moved on. Now, the other thing too, though, and certainly you and I both done a lot of this, is not the client who's had surgery, but the client who just has a unresolved orthopedic problem.
Yeah. Yep.
Right. So as common as not, I've had much more common. I've had clients who just have low back pain that has been going up and down for years, knee pain that just
Lingering.
comes and goes. Yeah. Shoulder stuff that's just kind of, it's not to the point where they're going to have surgery, or at least not yet.
Right.
And they just want to feel better, right? They just want to feel better. And one of the things that I think is true, or as I've certainly seen, that physical therapy is coming to, and really most other modalities dealing with orthopedic injuries come to, is like, movement is key.
Yeah.
Changing the movement
Yep.
patterns, changing how the muscles work, how the bones work. That's the key thing.
Yep.
Sorry.
Absolutely. There's no
There's
problem.
a there's a some car beeping outside. Sorry.
It's all right. No, but that's very much the case. We see that. Uh, I always say those lingering deficits or lingering issues.
Sorry.
Yeah, how many times do we have clients who have those lingering issues who they don't need surgery? They may have done
Right.
physical therapy 2 years ago, 3 years ago, and it still lingers on, and those are the ones that have a back problem that comes up once a month or once every
Right.
3 months or something of that nature, and that's really where I say I make my bread and butter. Those are the clients that stay with me
Absolutely.
longer because
Yep.
obviously PT helped with the acute situation, And this is
Yep.
how it was always broken down to me. Acute situation belongs in the medical field. Okay.
Yes.
If they have active back problem, if they're having spasms, how many times have you had a client barely walk in, and they're like, oh,
Right.
my back went out this morning. I said, I can't
Uh-huh.
do anything. That's not my job.
Or my
That's
right leg went
beyond,
numb.
right.
Right. This
That's
is like,
beyond our
okay,
scope.
something
Yeah.
something acute is happening right now. I cannot
Yeah.
stand up. Okay, we got a problem.
Exactly. That's when they go to the physician, the physical therapist. Now, the subacute or chronic situation, those are the ones that are our bread and butter. They're the ones that have already finished physical therapy. They still have lingering issues that pop up from time to time, or they were never fully resolved. And that's really where we can see, okay, is it just that joint? Are there other joints? Is there other
Right.
things in the kinetic chain? Could it be
Yep.
postural issues? I mean, I've
Yep.
told you before that tennis elbow, how many times have I helped that by working with posture and creating better postural awareness? And suddenly they're like, oh, yeah, we haven't done much for the forearm, but man, it's really reduced a
My
lot.
pain's gone down. Exactly.
So
Exactly.
again, we see the whole kinetic chain.
And we can work with it. I mean, again, our
Yeah.
scope of practice is not limited. Oftentimes, physical therapists, it's limited to all you can do is that joint. Like
And that
you need
prescription.
to treat the knee, right? That's kind of what you're qualified to do, and that's what insurance will pay for. And
Yep.
we're not limited by that. I mean,
Nope.
the good news is we're not. So we can look at somebody, and I know you've worked this way as well. Sometimes you've got a client, let's say, who has a knee problem, for example, just as a classic example, and maybe that knee is really swollen, it's really sore, it really is not something you want to work with directly right now, but you work
Mhm.
with the rest of the body. You do some core work, you do some arm work, you do
Yeah.
some work on the other leg, you work on the ankle, maybe you work on the hip. And all of that just keeps the body going, keeps the circulation going, keeps the movement patterns in their brain and in their body. And then as that knee, that acute problem comes down, then you start to work on the knee. So we have that ability. Like physical
Yep.
therapists can do that, but that's not really how they're supposed to work, depending on how their states are and how their insurance situation is.
Yeah. And look, no one gets perfect care from anybody, including us necessarily. We do our
Ever.
best. Everyone does their best.
Everyone does their
And
best for their bit.
right. And a lot of times if you're going to what I call the big box PT place, you're going to have the physical therapist who may be amazing, but may turn you over to a physical therapy aide or assistant to actually do the exercises with you. And that person may be working with 3 or 4 people. I experienced this myself the first time I had knee surgery. I loved my physical therapist. She was fantastic, but she would immediately turn me over. In the state of Maryland, she had to actually do the ultrasound herself. So she sat there with me talking to me while doing the ultrasound. Then wiped off the gunk, the gel, and
Well,
turned me over to someone who was working with 3 or 4 people at the same time. It's like, okay, you do your straight leg raises over here. Da, 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 da. And she's like conducting a symphony with all these
yeah,
people.
exactly.
And
Exactly.
I said, there's no way you can make sure everybody's doing all the exercises correctly. Hey, how many times have you tried to teach a group exercise class or a group reformer class when you got 7 or 8 people all with different issues, and trying to get everybody
Yeah.
to do everything perfectly is really a
No, it just doesn't.
challenge.
It's really hard, and
It
and
is.
that's again we are a little bit of a luxury. I mean, honestly, we know that
Mhm.
just price wise and everything
Yep.
else. Um, but to make the change, it often requires personalized attention for at least a short period of time. Then once you've established what they need to do, what the key things they need to focus on, then you can put them into a group setting or into another setting. But just that little bit of attention and that little bit of personalized focus, which is what we can provide, can
Mhm.
make all the difference in terms of people actually being able to make those corrections and make those improvements.
Yeah. Finding a good physical therapist, I'm gonna go back to for just briefly, is key. I'm not putting down PTs and I'm not putting down doctors. I have worked with some of the best PTs I think I've ever found. But again, I hoard them. I know who they
Yeah.
are. And I know
Yeah,
I've got a pelvic
exactly.
floor person, and I've got,
Yep.
the best knee person and the best back person. So if something happens, I can make one phone call and say, can you get so and so in? Yes, they know that you're taking cash only. Got it. All right. And yes, it's a luxury. Not everybody has that luxury, but if they can see us, and I do have a couple of clients right now. I just saw one a few minutes ago. He just left. He can only come in once a week to see me, but I give him homework, and I give him a lot of homework.
Exactly.
And we
Yep.
go over the homework each time and we make sure, are you doing it correctly? Lock him in on form, make sure he's doing it properly. And we do a little bit more each time. So I know he's being consistent with it. But again, I can spend a whole hour with him and I can really sit on his form. And today was the first time he walked in and actually said, I feel great. Nothing hurts today. My back doesn't, my knee, everything feels great. And he said, I don't want to jinx it. I feel like I should go do something, but I don't want to hurt myself. And I don't know what to do. I haven't felt like this in a long time. I'm like, no, savor the moment. I hope it
Enjoy.
lasts. It may not.
Right.
Things pop up here and there. But
Yep.
yeah, this is the idea. This is where we're heading for. We want to create that strength. It's amazing when you do get someone stronger and change their movement patterns, things change. And really, that's where we come in. Before we finish up, I also want to talk about tools,
Yes, that's right. Yes.
because that is something, like I said, I mentioned the Topotment devices, the thumpers, the massage guns. I don't want to use any names, but you all know what they are. We see them on television now. They're being shown, hammering away at the joint, which, let's face it, makes me cringe every time I see it. Right on that shoulder joint, hit that AC joint. No, but okay, that's one thing I'm not a fan of. Okay. I think that goes beyond our scope of practice. Our job is to help, and this was taught to me by a mentor of mine, Dr. Mike Jones, that we are here to manage medical conditions through exercise. That's really our job. We use movement exercise to do that, which means we use cardiovascular conditioning. We use flexibility and mobility. We use stability. We use strength. We use movement. We can do some
Hmm.
gait training. We can do all of that kind of stuff because it involves movement. What we cannot do, though, is use things like ultrasound, muscle stim machines,
Right.
uh, anything like that borders on physical therapy. If you are in doubt and questioning, don't do it, because that is going beyond your scope. And chances are, if you are questioning it, you probably haven't been trained properly on it anyway. So then it does go beyond what our skill set is. I can't say this enough, and I think you're going to back me up on this. Do what we're good at. I'm good at
Yes.
exercise. I'm
And leave
really
the
good
rest
at
of it
this.
to those people who are good at that.
I I'm a I'm a
Yeah.
decent and good massage person. I can get in there, but I've got a guy who's better than me. You know what?
Right. Yeah, me
He's
too.
also going to spend the whole hour, and I don't want to
Yeah.
do that.
Yeah.
So guess what? I'm
Exactly.
going to refer you to him. It's like, Jason, here,
Yep.
take him. Because
Yep.
guess what? You're going to spend an hour with him. He's going to come back to me and be able to move better and be able to do what I want him to do so I can focus on other stuff. Focus on what you're good at. We don't have to be a jack of all trades. Focus on
No.
what we're
And
good at.
yep. And I have to just say that more than one Pilates teacher that I've worked with has gotten a somewhat inflated sense of their own abilities. Yeah, it is really careful. Yeah, it is really important that we take that into account, right? That really you're not a medical professional unless you are. That's great, and if you have those
Mhm.
skills, that's great. But
Use them.
really understand the value of humility. Understand what your tools are. Get really good at your tools, and
Mhm.
let other people take care of their own expertise. And that's
Yes.
just, again, I'm pounding a little bit on that, but there, pounding on it again.
No, and that's important. That's important for us to realize. We can use any of our any of our exercise tools, which means I can use balance tools. I can use balls. I can use any of that. All of those things are great, foam rollers, whatever it is. Those are all within our scope of practice. When it goes beyond that, that's when it gets a little dicey. And that's when I'm going to say, just know your role, know your lane, stay in it, because we can do a whole lot. I can do a whole lot more in my lane than if I try and do everything. And I get really good at what I'm doing.
Absolutely. Absolutely. And the thing too is, if you are interested, if this really is like where you want to live in terms of the field, because there's so many ways to be in the movement field. If
Yep.
this is really where you want to go, get training, like go take specialized courses in what you're
Absolutely.
passionate about, whether it's working with low backs or working with pregnancy or working with scoliosis or whatever it is. There's a lot of really wonderful courses out there that are just awesome. So
Yep.
become an expert in what you want to do and what excites you.
Yep.
Yeah.
Did you? We talked about one other thing when you
Yes.
got together, and I was trying to show you a little note that was cueing you in on this, and that's nutrition.
Oh yeah.
That's a gray
Yeah. Yeah.
area.
Yeah.
That's a very
Yes.
gray area, and I'm going to say that because I even did it. When I first got into the industry, I was a personal trainer first, and then I was hired to be what was called a nutrition technician, which meant
Hmm.
I was now making meal plans for something, which I'm going to be honest with you was way out of my scope of practice. Yes, I was working on a minor in nutrition, no problem with that. But that was way out of my scope of practice. And I know that now. When we first start out, we're just trying to make a buck. We don't know what we don't know. Let's face it. We don't know,
Exactly.
you know,
Yeah.
but now I do know. And I see a lot of people trying to do too much and trying to create meal plans. And in the obesity class that I taught, I had to remind people in the room, I said, we're the freaks. We're the people who like to exercise. We're the people who will create all of our
Hmm.
meals for a whole week and put it in the refrigerator, all marked up. Here's my Monday food. Here's my Tuesday food. Here's my Wednesday food. And we'll carry it around in little coolers with us. Our clients don't want to have to do that stuff. We can't
do not
expect them to
do
do what
not
we
assume
want.
they're you, right? Do not assume they're you.
No, but people like this.
Absolutely. No,
And
absolutely.
And that's something we have to remind our people, whoever I'm teaching, is that look, we can't hold them to the same standards we would hold ourselves because they don't want to necessarily put in that time and energy for that last 5%, you know, that will make a difference. I saw once a chart that showed the perfect body and how many hours a day it took to maintain that. Then the next
Yeah.
level and how many hours a day. And then the next level, how many hours a day. And it was one of those things that most people would love to get to that middle level where it's like 3 to 4 hours a week, you know, mindful of their food.
Yeah. Yeah.
The far level was PEDs and tons of supplementation and measuring every single ounce of food that went into their mouth. Not everybody's really into that. And
That's
let's face
it's
it,
a 20-hour a week project. I mean, it really is.
yeah.
Yeah.
And
Yeah.
if you
Yeah. Yeah.
haven't gone to school as a nutritionist or a dietitian, and in certain states, it is, you have to be licensed by the state to be a dietitian or a nutritionist, depending on what state you're in. You can really be going against your scope of practice. So I'm going to say things like meal plans and whatnot are a little bit out of our scope.
I'm going to be even more intense about that and say they're completely out of our scope. Only because I've heard,
Yeah.
more random people give random nutritional advice to clients they don't know. They don't have their medical history. They have no idea what their
Bingo.
circumstances. I remember I was at a conference and um, uh, a lithe young Pilates teacher came up to me and said, "Oh, I really want to. I want to teach people how to lose weight." And I'm like, my first question was, "Have you ever had to lose weight?" She's like, "Oh, no, 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 but I know how to
Ding, ding,
do it."
ding.
It's like, okay, have you ever like really? My question was, have you ever had to lose weight? And she's like, no, I've been pretty much just because because I take care of myself and I know how to do it. And like, no, you have no idea what this is about. It's like there's
No
no
idea.
way I'm going to have you teach a class on how to have people lose weight when you have never had that experience. And when clearly your genetics don't require you to do much.
Right.
Right. So, I mean, that was a rather dramatic example, but I see that all the time. Oh, you
Yep.
should be paleo. Oh, you should be keto. Oh, you should. And it's so much of nutrition these days too is like YouTube driven and TikTok driven and the latest thing. I mean, it's always been the latest diet fad actually since I was a teenager, and there was like the grapefruit diet and the this and the that. It's always been
I
stupid,
remember
right,
those.
Ryan? It's like
Yes, yes.
always been stupid, and it's often been not science based, and it's often just, you know, not deeply grounded. So I would also say though about nutritionists is find a good one
Yes.
because there's also some very strong dogmas within nutrition that are just not
Oh,
appropriate for everybody, and
yeah.
not like so again, just like
No,
with
no,
every
no.
other practitioner, vet them, find the good ones, find the ones that really
Yep.
know how to work individually with that client, and refer them out. I've had great results with, I can think of like a few specific clients where we really worked together with our nutritionist, made massive changes for them.
Yep.
But it took both of us, like working together and kind of supporting that person on kind of a weekly basis for about 3 months to make just radical shifts for them.
Yeah.
But she needed both of us. Like I was only going to do my part and they were going to do their part, but it was the two of us that it took to really make things work.
To talk a little bit more about dogma, great story. A friend of mine, strength coach for a professional team, and he was talking about a friend of his who had, he was training this person and getting them on an incredible diet. The guy was pudgy. He couldn't lose weight to save his life. This was a hockey. Could not lose weight to save his
Hmm.
life. But he was strong as an ox. And one off season, he went back to his home. He was an Inuit. Went up to,
Hmm. Yeah.
way up north. And his diet changed radically based on his body chemistry. He came back ripped, stronger than he ever had been, because he was eating like 80 to 90% fat in his diet, because that's
He
what
was
his
he was
genetics.
an he was an Inuit. Yeah. Yeah.
Right.
Yeah.
He was finally getting off the carbs for his body,
Right.
and it worked
Yes.
for him. I'm going to stress that.
Exactly.
For him.
For him.
The same guy was working with another athlete and found that 80% carbohydrate worked for him.
Exactly.
Different
Exactly.
athletes, different people are going to have different needs. So you got to find someone who's willing to work with you and say, oh, maybe this type of diet doesn't work. Maybe this type does. Maybe that type does. So working with the right person who is also investigative, much like we are with the body, who can say, oh, that doesn't seem to be working. Let's change this. Let's change that, and be willing to modify rather than this is the way. This is the only way, which will work for a certain population for a certain length of time, but it's not going to work for everybody.
Exactly.
So keep
So
that in mind.
here's so there's a lot of pieces we've talked about here, as usual. We're just talking about like what is our role in
Mhm.
the whole prehab, pohab, post-hab, etc. world. What's our scope of practice? What
Yep.
can we and can't we do? And how do we really stay really strong within that scope of practice? Because do not get me wrong, what we do is really, really valuable in this
Vital.
world and with these clients. It's critical to really making the changes that a lot of them need to make. And we're the ones who can do that particular piece of the puzzle. But yeah,
Yep.
so enjoy what you do, get better at it, and keep working.
That is the key, in my opinion. If you stay in your lane and become the best at what you do and don't try and do everybody's job, you'll have work. I have a waiting list and I can't get everybody in. And that's just
Yeah.
because I'm good at what I do. I don't try and do everybody else's job.
Yep.
Get really good at what you do. Focus on that. That should be your focus. And in time, that's going to be what pays off. Trying to do everyone else's
Absolutely.
job is not going to pay off in the end.
Absolutely.
Well, thank you guys so much for joining us for another, I thought, a great topic, something that I don't think gets talked about enough. So I'm glad we were able to discuss it, and especially in the world of post rehab and pre rehab and all of that kind of stuff. So I'm glad we did it. Do us a favor, hit that like and subscribe button. We really do appreciate it. Thank you so much. You can always get in touch with us through our email account at movingconvos@gmail.com. For Nora St. John and Brian Ritchie, we'll see y'all next week.
Thanks, guys.